Good evening and welcome to TAY-MORG News at 6. I'm Taylor Stone.
And I'm Morgan Whitehair. Good evening.
Tonight, we have a compelling story about a 7-year-old boy who lives in the highlands of Guatemala. This boy is living with a disease that makes him not able to attend school and live life as a normal 7-year-old boy. We are going to travel through Juan's story tonight.
Guatemala is a nation slightly smaller than Tennessee in size. The climate is very hot and humid in the lowlands and cooler in the highlands where our patient lives. The country is mostly mountainous, and the area has many natural hazards, such as volcanoes in the mountains and occasional violent earthquakes. There are also environmental issues, such as deforestation, soil erosion, and water pollution.
Guatemala has been in several civil wars, and although they are no longer in one, there is still great unrest and tension within the nation. Guatemala has an inadequate education system, widespread health and sanitation deficiencies, and very high rates of crime and violence. People still die from very treatable and communicable diseases such as diarrhea, cholera, pneumonia, malnutrition, and tuberculosis. There's only about 59% of the population that can even access health care and only 58% with access to safe water.
There isn't any type of modern culture. The culture strongly reflects that of Mayan descent and Spanish influences. This makes modern treatment out of the question. The main language spoken is Spanish, and most natives speak it. English is still spoken in some main tourist areas.
There are 3 main diseases that are very common in this nation, and that is malaria, cholera, and tuberculosis. Malaria is caused by a parasite that is transmitted from one human to another by the bite of the Anopheles mosquitoes. Cholera is a disease which is caused by a bacteria called Vibrio cholerae. This bacteria releases a toxin that causes water increase in the intestines, which causes for very watery diarrhea. And in any other nation, this wouldn't be a problem, but with the poor health standards that Guatemala has, it can be deadly. And tuberculosis is a contagious disease that can be spread among humans. Tuberculosis mainly starts in the lungs, but then it can travel to other organs if not treated, which is usually what happens. People are more at risk of contracting these diseases when they are living in crowded, unsanitary areas and have a lack of nutrition, which is also very common in Guatemala.
Now, over in Guatemala, we have Dr. Maria Sanchez, which is the physician who completed Juan's physical examination. Good evening, doctor. Thanks for joining us.
Thanks for having me, ladies.
What things can you inform us about Juan's physical examination?
Well, there are several things that I can tell you about Juan after completing his physical exam. Juan's vitals, which include his respiratory rate, heart rate, blood pressure, and temperature, all seem to be quite normal. Juan is definitely small for his age and has a patch of skin on his face with what we would call excoriations, which is most likely just somewhere he's had a scratch and has kept picking at it and it ended up getting infected. There are no other problems with his skin or lymphatics. His head, ears, nose, and throat are fine, but he has extremely poor dentition and multiple cavities just because they don't have the supplies to brush their teeth. His eyes are icteric, which means jaundice. They have a yellow color on the sclera. Juan's neck, chest, cardiovascular system, and abdomen are all working properly, and nothing showed up that shouldn't be there. When we examined his back and extremities, we noticed places where the muscle was very tight and short because of so much hypertonic stress put on that muscle. These are called contractures, and they occurred on Juan's left shoulder, elbow, hip, and knee. Juan also has a hemiparesis, or weakness on the left side of his body, and a spastic gait, which just means that walking is a struggle. That is all that I have found out from completing his physical examination.
Thanks, Dr. Sanchez, for everything. After Juan's physical examination was complete, doctors were able to diagnose him with spastic cerebral palsy. When children have spastic cerebral palsy, it is very common for it to only affect one side of the body, which explains why Juan is having all his trouble on the left side. There are many things that could have caused Juan to have cerebral palsy, such as an infection during pregnancy, severe jaundice as an infant, the RH compatibility between the infant and the mother, and severe oxygen deprivation. It isn't clear exactly what caused Juan to have cerebral palsy, but those are just some of the possibilities.
Juan also suffers from the contractures due to cerebral palsy. Contractures are seen the worst in people with spastic cerebral palsy. Juan also has left hemiparesis, which is where the left side of his body is very weak. This could also be because of the cerebral palsy, but it's found that a certain form of tuberculosis, called spinal cord tuberculosis or meningitis, can cause a weakness on a certain side of the body. Since tuberculosis isn't uncommon in the nation of Guatemala, there is a very big possibility that Juan could also have tuberculosis. Juan has icteric or jaundiced eyes, which give them a yellow color. This is due to an excess of bilirubin in the blood. The liver is normally what filters out the bilirubin, and having jaundice could mean a malfunction in the liver. How is it possible to get Juan the treatment he needs at a price that he can afford? That's what we are going to tell you next.
Truth be told, cerebral palsy can't be cured. Physical therapy is one of the most important things needed for children with cerebral palsy. The first step in Juan's treatment plan is meeting with a physical therapist and for Juan's family to learn certain exercises that they can perform with Juan throughout his life to help him with his condition. In Guatemala, there is a program called Angels Abroad, which is a program that is located in Guatemala City and offers orthopedic surgery and dental surgery for affordable prices that Juan's family could hopefully afford. With Juan's dental condition, it is possible that he may not be able to ever brush his teeth on his own, and Juan's family needs to be notified of that so they can help in every way they can. Special devices and equipment such as braces, casts, and splints may also be used throughout Juan's life to help with his physical disabilities. There are also medicines that can be used called antispasmodic medicines that relax muscles and reduce muscle spasms. These are usually taken before the physical therapy is completed.
If the left hemiparesis is being caused by tuberculosis, there can be treatment for tuberculosis that might help the weakness on the left side of his body. There is a drug called dexamethasone oral, which helps specifically with the meningitis tuberculosis. The cost can be as low as $10 a month, and this can help with not only his tuberculosis, but also with the weakness he is experiencing with the left side of his body. Juan is experiencing some jaundice of the eyes, which could mean a malfunction of the liver, or there could be several other causes for this jaundice. He will need to have tests run to determine exactly what is making his eyes jaundice, and from there, treatment can be given according to what is found. The excoriations on his face can be treated by a simple medication such as Neosporin, which will help the infection stop spreading and hopefully heal it altogether. The cost of each tube of Neosporin is only about $6.99 and could last them quite a while.
With all of these things considered, Juan should be a healthier, happier 7-year-old boy when we go back to check on him.
Thanks for watching TAYMORG News at 6. Have a great night.
Good night.
You're very welcome, ladies.